I tell my PhD students, my postdocs, my medical students, it takes 30 years to change the standard of care. And so I've made it my mission to do the research, to train clinicians, to train the next level of scientists. And I fully anticipate within 30 years, the standard of care will be that we'll offer drugs. At the same time, say it's vital that you also address modifiable lifestyle factors. We're 15 years into this. We're halfway there.
This is the Visible Voices podcast. I'm your host, Dr. Resa E. Lewis. In today's episode, I speak with Dr. Terry Wahls. In 2000, she became a patient. She was diagnosed with relapsing-remitting MS, that's multiple sclerosis, which progressed to secondary progressive MS. In 2007, her condition deteriorated to the point that she required a tilt-recline wheelchair. That same year, she began a journey in human-centered design. Terry redesigned her diet using the medical literature, functional medicine, and her knowledge of the hunter-gatherer diet to develop what would become the Wahls Protocol. Within a year, she regained mobility, including riding a bicycle and walking without a cane. She now regularly runs on a treadmill. Terry is the author of a 2020 book originally published in 2014, The Wahls Protocol, a radical new way to treat all chronic autoimmune conditions using Paleo principles. Terry, welcome to the Visible Voices podcast.
Hey, thanks so much for having me.
I'm going to start our conversation focusing on you.
Okay.
How old are you?
I am 69, soon to be 70.
And how old do you feel?
Well, I do these biomarker assessments, telomeres, and the telomeres tell me that by telomeres, I'm 15 years younger than my biologic age, quite a bit younger.
What fixed symptoms do you live with today?
None.
So
the fixed symptoms I have worsening pain in my right hip, so I have some severe osteoarthritis there. Keep in mind, my dad had severe osteoarthritis, had his hip replaced in his early 60s. My brothers likewise have had their hips replaced in their early 60s.
For the audience that may not be familiar with the Wahls Protocol, let's start with actually looking at the differences between the Wahls Protocol and the standard Paleo diet.
The standard Paleo diet often includes dairy, has meat, doesn't really give any particular directions on vegetables, fermented foods, nuts, and seeds. So I'd already been following the Paleo diet for 5 years, and I had the theory that mitochondrial dysfunction drove disability. So I'd created a supplement cocktail for my mitochondria, discovered Institute for Functional Medicine had a longer list of supplements, again, all for my mitochondria. Then I had this big aha, and I laugh now, Resa, how long it took to have this aha. Like, what if I redesigned my paleo diet based on this long list of nutrients that identified as really important to mitochondria health and to brain health? So that was a few more months of research to figure out where those nutrients were in the food supply of a paleo diet. So now I have a very structured, this is what got to eat. And so I started eating that way. It was really quite striking. Within a month, my fatigue was definitely reduced. My pain was greatly reduced. My mental clarity was improving. And my physical therapist said, Terry, you are getting stronger. And he was advancing my exercise. That is super interesting. So I combined what we've known evolutionarily, the foods that we have been eating. And of course, there are many different versions of the paleo diet because there are many ecosystems all around the world. What I did was, okay, given the foods that I can access, how would I have the great supply of all the nutrients that science says my brain needs to rebuild itself? And of course, I'm like, how long is it going to take? It might take a couple of years. It's probably about 7 years to rebuild all the molecules in your brain, 20 years to rebuild the molecules in your skeleton. I went from being unable to sit up to walking without a cane in about 3 months, and to biking around the block in 6 months, and then a year, well, actually 9 months to a year, biking 18.5 miles. Now, I should be clear that diet's part of it, meditation is part of it, exercise is part of it, intensive physical therapy and is also doing electrical stimulation of muscles, something that athletes have been doing for decades, very intensively with a physical therapist who treats athletes. And I am a former athlete, so I really understood and was committed to an athletic approach to training.
You mentioned mitochondria.
So let's talk about mitochondria. We'll go back several billion years ago when we were single cell organisms and we started making oxygen and killed off, I believe, 98% of all life forms because oxygen was toxic. But there were some bacteria that, through random mutations, learned how to use oxygen to make adenosine triphosphate or ATP much more efficiently. And ATP is sort of like the money the cell uses to run the chemistry of life. In these very efficient oxygen using bacteria were engulfed by bigger bacteria that couldn't use that oxygen. And they developed a cooperative relationship that allowed both the new tiny bacteria, which are really the grandmothers of all of our mitochondria because they come down the maternal line. So that's something dad never gave you, is something that mom gave you, your mitochondria. And over billions of years, we evolved into animals, multicellular, and all animals have these mitochondria. The parts of our body that need the most energy, and you think brains, retina, heart, have the most mitochondria per cell. And if you can't make the ATP, you can't make the money well enough, the function of that cell begins to diminish. So I had this aha, like, okay, my brain needs more help making helping the mitochondria work. I was taking these supplements, which were helpful, but they didn't fix me. What's super interesting is when I really redesigned my diet to maximize the food sources for those same nutrients. And it was complicated, these long lists of all these foods I was stressing. And so, this changes how I think about disease and health. It changes how I practice medicine. And I start teaching my veterans, but I have to do it in just a few minutes. And so I ultimately create a algorithm to teach the concept so I could have people in a 5-minute visit because the residents are seeing the patients. I only get to like 5 minutes, so I have to have a very short, memorable message. And so over time, that would become the essence of the Wahls Protocol. People know me for the 9 cups of vegetables, 3 cups of green leafies, 3 cups of sulfur-rich in the cabbage, onion, mushroom family, 3 cups of really deep color. And then we talk about plenty of protein, and I have strategies for vegetarians, strategies for meat eaters. And then when they get that down and they're ready to be a little more adventuresome, then we talk about fermented foods and kimchis and sauerkrauts and kefirs and yogurts. And we talk about liver, and that liver is fabulously good for us, and how to make it delicious. We talk about heart and gizzards and kidney and bone broth and all of those things. And then eventually there are reasons that sometimes a ketogenic diet is really better for the patient. And so there are times that we would put people specifically on a ketogenic diet.
The connection between mitochondria, myelin, and why this actually helps brain and help
Yeah.
you.
So there's increasing awareness that for some people, we can't use our sugar very well in the brain. It becomes less and less effective. So the brain is starving for energy. But in those same people, most of them can still use ketone bodies or fats, which is why for people with seizures, with cognitive decline, we've known for a long time that a ketogenic diet can be very helpful for those individuals.
Yeah.
We're now having more research that ketogenic diets can be very helpful for people who are overweight, obese, type 2 diabetes, people who are being treated for cancer. And there's certainly emerging evidence that people with really severe psychiatric problems, severe anxiety, severe depression, bipolar, psychoses, delusions, hallucinations, they've done remarkably better on a ketogenic diet. And and here's another group that is stunning: anorexia nervosa folks who are losing weight too much weight. You'd think you'd never put them on a ketogenic diet because the ketogenic diet folks lose weight, particularly if they're overweight or obese. But there are some psychiatrists that are using ketogenic diet for anorexia nervosa, and have found that to be very helpful, and it stabilizes their sense of body image, and helps them stabilize their weight.
This goes back to the behavior change. And I've heard you chat about what you have seen make behavior change stick.
We've been very, very successful, and one of the first, and this my veterans taught me this. The most powerful classes we would have would be, what is life's meaning, and how are you giving back to your community? And so it would be incredibly helpful to touch into what matters to you, what can you not do that you would like to be doing again if your health could improve just a bit. And now we have a concrete goal. It's really wonderful when someone says, my son or daughter's getting married in 2 years or 3 years, and I want to walk them down the aisle. Okay, that is like gold. And so now we have a reason to want to do this. Or, I'm having a hard time playing with my children on the floor, and I'd like to do that again.
Yeah.
Or, my son or daughter is going to be having a child, and I want to be part of that grandchild's life. So we have to have a reason to do the work, because biologically, our brains are wired to seek pleasure and avoid pain and discomfort.
How easy or difficult is it for people to have this behavior change if they're doing it solo versus having the whole family on board?
In my practice and in my clinical trials, we stress this is a family intervention. And so I want people to adopt health behavior change that the family can adopt. So if the family is like, there's no way I can do a paleo diet, but I could do a Mediterranean diet. I'm like, okay, do the Mediterranean diet. Or there's no way I'm going to feel good about doing a paleo diet, but I feel okay about doing a low fat swank diet. Like, okay, let's start there. And then I do have people who's like, I am so ill. I'm so worried about the future. I want the most potent interventions you've got. And my family's behind me. We're going to do this all together. And so then we'll talk about what that might look like.
Yeah.
It's super important to listen deeply to the patient and the family. Do they want a great, big, most potent intervention, or do they want an intervention that will be the easiest for them to be successful at? And they'll tell you if you're willing to listen.
They say if you listen to the patient, they will tell you what is wrong with them.
And they will tell you how big of the intervention they're ready to implement. It's vital that you help them choose intervention they can be successful at. Sometimes I have people, want to have a great big intervention, and I have to say, okay, we can have a lot of components, but we're going to bite size what we're going to do so you can have one success, then the next success, then the next success.
What you do is human-centered design. You put the patient, the care providers at the center of the decision-making and the discussion, and create a plan that works for them. In 2011, your TEDx talk called Minding Your Mitochondria.
Yeah, 4 million views.
I saw in the comments something about the MS Society, and then you posted actually on Instagram, I did not see any of this coming. Not my recovery, not the change in my clinical practice, not the resistance from dietitians and medical colleagues. Nor did I anticipate becoming a banned speaker for creating false hope by the National MS Society. However, now they've actually given you a 1.5 million grant to pursue your work through clinical trials and such. Is that right?
Yeah, and what happened is the public drove this. I was banned in 2009. My ideas were really radical. People didn't hear that I was saying, I wasn't saying don't take drugs. I was saying you got to fix your diet and lifestyle and work with your neurologist. I'm not a neurologist. But so I learned to be much more clear that I'm not anti-drug. I treat my disease very, very aggressively. I realize people have to read and make their own decision about the risks that they want to take. but I want everyone to work on diet and lifestyle. So
Yeah.
I just went about my life, spoke where I was invited, did my research, published our findings, presented our findings, slowly got into more higher impact journals, did the TED Talk. The public response to the TED Talk was big enough that I got my book deal. My book came out in 2014. And because the MS Society monitors social media, they saw this explosion of social media mentions about diet, about the Paleo diet, about the Wahls Protocol, about Dr. Terry Wahls, that completely swamped all the conversations about the new highly effective DMTs. And their donor said, "We want a wellness conference. We want to talk about your research priorities." So they tracked me down, got me on the phone, wanted me to come. And by the way, I was a plenary speaker at another conference the day they wanted me to speak. So I said, "Well, we have a couple of things. I'm a plenary speaker at another conference. I can see if I can get that moved to a different day. However, I'm a banned speaker by you guys. And so for me to come, and I'm open to it if I can get in writing that I'm no longer banned." It took them 20 minutes. And great, fortunately, the other event agreed to change the day that I spoke. And so I was able to attend both events. The MS Society told me that they really wanted to see a proposal comparing the swank and the Wahls diets. And so I wrote that and would be funded. And we started that study in 2016.
Great story. You just don't know. You got to listen to your gut. Trust your gut.
Learn how to play well in the sandbox.
Yeah.
And so fortunately, my university said, "Terry, you have to play well in the sandbox. We're going to give you some coaching. We're going to send you to the complementary alternative medicine clinics. You know how to talk about this in the public and in your notes.
Yeah.
And because we want you to be successful." And so I'm super grateful that I got banned. So my university said, "Terry, you can't go around upsetting people. So we're going to teach you how to do this more effectively." And so that was very helpful.
Yeah.
And then, fortunately, the MS Society learned to listen to their constituents, and they have made dietary and wellness and stress management part of their research priorities.
The name of this podcast is The Visible Voices, and you've just illustrated how you have evolved and become even more of a visible voice. When did you realize you had a voice, and when did you start using that voice?
One of the things I've understood in life is there's always going to be terrible challenges in our life, but we can choose how we respond. We can choose growth. We can choose, like, okay, it may feel overwhelming, but I'll just do the next small thing that I can do to support what I think needs to happen, either in my life or in my community. At various times throughout my medical training, medical practice, some of my other colleagues, they had a very different view. Like they felt like they had no control over the events. I'm like, no, 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 we always have control. We always have control. And even when, things were going relentlessly downhill, and they did that for 27 years in my life. I had young kids, and I knew that my young children who were, 5 and 8, and then 8 and 11, etc., they were watching what I was doing. And I could either piss and moan and woe is me, or I could get up and do my little physical therapy every day, and be reading and thinking, in making what little choices I could to slow my decline as well as I could.
Yeah.
And now my 2 children are 33 and 30, and they talk about how they really understand that, yep, terrible things can happen, but there are always things that you can do to make your circumstances a little bit better, and you may be quite surprised that each little bit better may lead to a whole lot better
Yeah.
for your health, for your community, for your worldview.
We have choice. We have choice. At one point, you were very strongly advocating like coconut oil, and now I've heard you speak a little bit more about olive oil. I'm wondering if you could clarify where you stand on that.
A medium chain triglyceride generates more ketones than the other fats. And so a medium chain triglyceride ketogenic diet is easier to follow. Some individuals will have a elevation of their lipid profile. So what I'd like to do is check baseline lipids. We look at the cardiovascular risk factors. Is there a family history of dementia, APOE4? In those circumstances, I really want them to use an olive oil-based ketogenic diet. Whatever ketogenic diet you do, you really need to follow lipids closely
Yep.
to see how that person responds.
The Wahls Protocol does not include dairy.
Yeah, it does include, gluten, dairy, or eggs. When I started doing my clinical trials, my, IRB, the committee that oversees research said, "Yeah, really have to follow your protocol as closely as you can." And so if I have gluten, dairy, or eggs, it triggers my trigeminal neuralgia.
Mm.
Even to this day, let's see, camel milk, I tried goat milk, triggered my trigeminal neuralgia, did that a couple times, said, I don't need to try it anymore." People have tried to get me to try eggs again, um, and I really liked eggs. But, trigeminal neuralgia flares are so horrific, and I just can't intentionally.
My friend told me about you, about the protocol, about the book, and he has someone close to him who has MS. And, obviously in one's book, one is going to have positive attestations. So I spoke with this friend and I was so glad that they were welcoming of me and they verified that they found the Wahls Protocol and it completely reversed their symptoms of MS and they live by it. And when they sort of knowingly cheat, like a piece of cake, all of a sudden they just develop horrible fatigue. And they also had symptoms of trigeminal neuralgia. And so those triggers, the sensitivity of the food and staying on the diet seems quite pronounced.
When people enroll in our studies, and when they enroll in my clinical practice or in any of the programs that we have online, we talk about paying attention to what I call biosensors. And so if you have pain, that's super helpful because, biologically, we want to avoid pain. If you can't see because you have flare of optic neuritis, that's also very helpful because vision is so important to us. If you have a motor problem, that's helpful. If you have mood, that's a little harder for people may ignore that. Fatigue, generally people will respond to. So we try to have people pay attention to what are your biosensors. And when you experience a flare of your biosensor symptom, look back to your previous 24 hours and have theories as to what the trigger was. And you may discover there was a food trigger or a stress trigger or a wildfire. There's a lot of wildfires, a local air pollution problem, and a virus. So if I get some viruses, that will trigger my trigeminal neuralgia.
Hmm.
If I come to your house, Risa, and you don't do a good job of reading the ingredients, labels, you might accidentally give me gluten, dairy, or eggs.
Mm.
So eating at friends makes me very nervous. I have a big conversation. I'll
Yeah.
bring food along because I've had people accidentally, give me foods that are a problem.
Yeah.
If people can get tuned into their biosensor and then have a thoughtful conversation between themselves and their family, okay, I had a flare of my symptom. What do you think might have been the trigger?
Right.
In our studies, very consistently, the people who've been the most successful are those who have a biosensor, and they're like, I have an indiscretion. I feel terrible. So, I decided those indiscretions just were not worth it anymore.
You and I both know that those biosensors can be heightened. We can become even more aware with paying attention to some of the other behavioral changes, sleep, meditation, yoga, being in nature, all these things that heighten our awareness of ourselves.
Absolutely. Teaching people mindfulness can be very, very helpful.
Yeah. When I was young, uh, elementary school, we in my household were not allowed to leave the house without taking two vitamins. One was Tribiflor, which the pediatrician prescribed 'cause that it was a fluoride vitamin. The other was a cod liver oil pill. And this is something that my mom swore by because she said that it would help prevent us from getting sick.
I think it's really helpful if you have a little vitamin D boost. So if you have a little higher vitamin D, you'll have more of the antimicrobial peptide, and so that will protect you from your first exposure to a virus or a bacteria a little more effectively. A multivitamin, certainly now, as we have more and more ultra processed foods, we have more nutrient insufficiencies. So I think a multivitamin, multimineral can be very helpful. And so could getting rid of the flour-based foods and the, sugar-added, beverages. That would be super helpful as well.
Agree. Cod liver oil, though, not necessarily that
Oh,
effective?
yeah. So cod liver oil, yes, because it gave you extra vitamin D, and it
I
gave
see.
you more omega-3s. And when I was a infant, my mama told me that, you put, a cod liver oil in the, bottle, and that was, a standard recommendation, which was fabulously good for my brain.
Mhm.
So I'm super glad that my, mama did that.
Thanks, Mom. Thanks, Mom. Soaking seeds, legumes, and grains. Why soaking, what it does to
Well, if
help.
if you soak them overnight, you begin the germination process, so it reduces the, phytates, so, the minerals become more, readily absorbed. Yes, I think that is super helpful. In my clinical practice, I can really personalize how many grams of carbs I'm gonna recommend, how many grams of protein, and fat, to meet your needs. For your listeners, I want you to just begin where you're at gradually shifting your diet towards a more healthful choices, less added sugar, less white flour, more green leafy vegetables, more sulfur-rich vegetables, more deep color.
Just circle back to autoimmune conditions and long COVID. I'm wondering if you
Yeah.
can clarify for those that are living with long COVID or were infected and are
Well,
concerned about developing it, what would you suggest in terms of behavioral and dietary modifications?
well, the first thing, the people living with long COVID, please go to terrywalls.com/trials and register for my long COVID study. We have a long COVID study. It's a virtual intervention, and so there be some opportunities for you there. Uh, uh, Again, the long COVID individual, you have your innate immune system sort of stuck on, and the resolution phase has not been turned on. What can we do for these people? Improve nutrition. I think a, multivitamin, B vitamins, fish oil, vitamin D, great start. Having more protein, more non-starchy vegetables, and it's really important to get rid of the sugar, get rid of the white flour. So we want you to improve your nutrition. And then I would work on sleep, work on stress reduction, and exercise is going to have to be at a very gradual, incremental plan to increase. And when I talk about exercise with my patients, I have patients who range from athletic to wheelchair bound to bed bound. And so we talk about doing exercise. I talk about high intensity, moderate intensity, low intensity, and you make that decision based on your can you talk or sing while you're doing the exercise. If you can sing, that's like row your boats or any of your wheels go around the bus. If you can sing while you're exercising, that's a low intensity exercise. If you can't sing, but you and I could still be talking, that's moderate intensity. If now I'm working so hard I can't talk to you, Risa, that's high intensity. So for someone who is bedbound, just doing half jumping jacks with the arms like this could be a high intensity exercise.
Yeah.
And or it might be moderate intensity, or it might be low intensity. But if we have them judge it based on how well they breathe, and then the next advice is, I want you to exercise to a level that you're comfortable for a minute, and then are you back to your usual energy within an hour? Yeah. And then you can gradually increase that, a minute, 2 minutes, 3 minutes, 5 minutes, as long as you are back to your usual energy level within the hour.
You gave a little bit of a foreshadow of your clinical trials that are ongoing. Can you tell us what you and your teams are working on now?
We have a really marvelous study comparing the ketogenic diet, olive oil based, to a modified paleo elimination diet compared to usual diet. In the usual diet group, we give information about the dietary guidelines. We get MRIs at baseline, clinical measures, patient-reported outcomes, and they'll come back at 3 months for some blood work, clinical measures. And again, at 24 months, we'll repeat the MRI, clinical measures, patient-reported outcomes, and we get a bunch of blood and saliva for biomarkers. Yeah. We have 162 people in. Our primary outcome was 6 months, and we had 158 complete that. That's a 97.5% retention rate, which is extraordinary. And we will finish, we anticipate getting our last study visit early July of 2026. We'll be cleaning the data, analyzing it later in 2026. In 2027, we will be presenting whatever it is we find at the international MS meetings, and then we will be submitting it for publication in 2028. We have a couple more studies that we are planning, looking at some biomarkers, and can you change microbiome, improve the health of the microbiome with some online applications that we've developed. So we're very excited about that. And we have studies ongoing for fibromyalgia, for long COVID. And we also have a patient registry for if you have people with a mental health issue, neurologic issue, psychiatric issue, we want them to sign up for a patient registry so we can include them and notify them about our future clinical trials.
Terry, your legacy.
I tell my PhD students, my postdocs, my medical students, it takes 30 years to change the standard of care. And so I've made it my mission to do the research, to train clinicians, to train the next level of scientists. And I fully anticipate within 30 years, the standard of care will be that will offer drugs. At the same time, say it's vital that you also address modifiable lifestyle factors. We're 15 years into this. We're halfway there. When I go to the scientific meetings, my fellow scientists and neurologists are whipping out their phones saying, "Hey, Dr. Wahls, I have a few questions, and could my nurse get a picture of us, because my team would so appreciate that, and my patients would so appreciate that." It was super fun. The last consortium of MS centers, the last talk was about the microbiome, gut-brain axis, and they were talking about these dietary interventions, and they had my book up, and they were talking about what I've done and my impact on this whole conversation. So I went up, introduced myself, and that scientist and I've been talking about how we might collaborate in the future.
The Visible Voices podcast amplifies voices in the healthcare, equity, and current trend spaces. Our team includes Dr. Giuliano DePortu and me, Dr. Resa E. Lewis. Find me at Resa E. Lewis, MD on social media, or visit thevisiblevoicespodcast.com. Find us wherever you listen to podcasts and watch our episodes on YouTube. This podcast is for education and entertainment purposes only. The views and opinions expressed by our hosts and guests are their own and do not reflect the opinions of their institutions. Information shared here should never substitute for clinical judgment or for medical advice. Together, we're making healthcare more equitable, one visible voice at a time.
If you want to learn more, go to terrywahls.com, sign up for my email, go to the Instagram, Dr. Terry Wahls. I have many free resources, many free webinars to educate you on the many things you can do to improve your health and vitality, whatever your underlying health challenges are.